The goal of this presentation is to offer you some business opportunities for musculoskeletal ultrasound in primary care, which we have experienced ourselves in clinical practice in some countries where we are active. Please be aware that there are lots of differences between countries. For example, the German market is more hieratic with regards to the doctor-physiotherapist relationship than the Dutch market. On the other hand, the German market offers a special privilege for Heilpraktikers, a certain specialization which makes application of ultrasound within German physiotherapy much easier. The United Kingdom has embraced the extended scope principle, which offers good possibilities for applying ultrasound in clinical practice. Countries where patients have direct access to physiotherapy, like for example in the Netherlands and Sweden, also benefit from the use of ultrasound in clinical practice. It can be an important tool to screen patients to decide whether there is an indication for physiotherapy or not. France is one of the first countries where it's officially stated by law that physiotherapists are allowed to use ultrasound within their clinical practice. This strong legal position avoids discussion with professionals who feel sometimes threatened by the national and international developments in musculoskeletal ultrasound. It's also a fact that ultrasound in primary care physiotherapy is quite new in some countries, like for example Switzerland and Belgium, which is in contrast with some other countries like the Netherlands, where it's being used since 1995. In any case, it's clear to us that there are good business opportunities for the application of musculoskeletal ultrasound in clinical practice in all countries. In this presentation, we offer some successful ways to create an interesting business model around ultrasound based on our experiences. If you have good or bad experiences in your own country, or you would like to share info or ideas about possible business models, then please, by all means, share these with us. The whole musculoskeletal ultrasound in primary care community benefits of good ideas and best practices. If everybody works individually, we can't be a strong international alliance that advocates the use of quality musculoskeletal ultrasound, or as we like to say, the stethoscope for physiotherapists. Remember always to follow rules and regulations which apply to your specific country. Let me first discuss the use of musculoskeletal ultrasound in your own clinical practice. You could use musculoskeletal ultrasound as an extra in your screening process in direct access within your clinical examination or in treatment evaluations. Normally, you would only do your clinical examination. In the new situation, you can offer your patient an extra. This extra, the musculoskeletal ultrasound assessment, should be offered to the patient as something special, innovative, and as an added value for the quality of the examination or evaluation. The patient can decide, him or herself, whether he or she wants to have such an examination. The extra musculoskeletal ultrasound can be paid by the patient privately, or one could charge one extra physiotherapy treatment if possible. In the countries where we are active, we can see private charges between 25 to 75 euros per musculoskeletal ultrasound. If you offer quality and a true added value for the patient, patients are willing to pay a certain amount that's realistic for the local market. You can sell the ultrasound assessment and clinical examination as one package deal. It's always included. The ultrasound assessment is part of your service to the patient. The patients will feel that the ultrasound assessment is free of charge. This is a strong benefit for the marketing of your private practice. Patients will see that you invest in quality. They will also see you using it, resulting in the fact that in no time people within your area know that you can really look into their bodies. You will gain much more trust. People will choose your practice sooner over another practice. Of course, only when you offer quality and an extra added value. Some physiotherapists who treat private patients choose to not increase prices of treatments or examinations when they're starting to use ultrasound. Other physiotherapists will rise all prices a little bit, also of each treatment, to have some return of investment. An ultrasound system is a good investment, but an investment it still is. If there are more physiotherapists in your private practice, it would be good if more colleagues would be trained in musculoskeletal ultrasound. This has several advantages. The first one is that more sonographers in your company will lead to more people making use of the system. The return of investment is easier if more people are using the same system. The second advantage is keeping the skills and knowledge within your company. If the only sonographer in your company would leave you for another job somewhere else, a brain drain will happen. You will be left behind with an ultrasound system that nobody else knows how to use. More sonographers in your company will prevent such a brain drain. The third advantage is more quality. Ultrasound has a long learning curve and is highly experience dependent. One sonographer cannot know everything in detail. It would be good to split tasks. One sonographer focuses on, for example, the upper extremity joints. The other sonographer focuses on the lower extremity joints. With this splitting of tasks, more expertise and more quality is obtained. It's better being a specialist in 3 joints than a generalist in 6 joints. Could be a motto that fits your way of working. I would really recommend to search for collaborations or partnerships with certain colleagues and partners within your region. Try to collaborate and convince them that you can strengthen them, instead that you are a threat to them. You could contact colleagues in your region, sports clubs, doctors and physicians. They could send you patients for a musculoskeletal ultrasound assessment. You will check the patient, you will write a report and include the ultrasound scans obtained. After that, you will refer the patient back to where he or she came from. This last thing, sending the patient back, is very important. Never ever keep a patient sent to you by a referring colleague in your practice. In that case, you will be regarded as hostile and as a competitor. Present yourself as a sincere help to them. The professionals who refer the patients to you have the advantage in not having to invest in education, in the learning curve and system. You have the benefit of having more business in the topic you're good at. You can charge the referring colleagues, sports club, doctors and physicians a certain amount of money per musculoskeletal ultrasound assessment. It could only be done differently. They don't send patients to you, but you will go to them. At the locations of your colleagues, sport clubs, doctors or physicians, you could do an in-company musculoskeletal ultrasound consultation hour for the patients of your clients. You can get paid per hour or per patient. I know numerous examples of Dutch physiotherapists who work together with general practitioners. The physiotherapist does the ultrasound scanning and determines together with the general practitioner where an injection should be placed. After that, the general practitioner places the actual injection, preferably under ultrasound guidance. Numerous scientific research has proven that ultrasound-guided injections are more successful than injections without guidance of ultrasound. Also, without ultrasound-guided injections collaborations, could there be an advantage for the general practitioner to work together with the physiotherapist? The physiotherapist has more time to perform quality ultrasound scanning. Generally, general practitioners have less time. The general practitioners don't have to send the patient to hospital for an expensive MRI, but can do certain diagnostics in their own practice. Patients get reimbursement of healthcare costs delivered by physicians and general practitioners. This means that physicians and general practitioners are in the opportunity to hire your skills. Yes, ultrasound can be a very interesting business model, but only if certain internal and external factors are optimal. Your professional attitude determines the success of your ultrasound business. We know that professionals who are curious, eager to learn, quality-driven and motivated will most likely become competent sonographers at the levels they have followed. A business can only be successful in the long run if quality is being delivered. A good training is needed, which contains a blended learning, a mix of hands-on practice and theory. More hands-on practice is always better. This is the reason why we use an e-learning platform to make sure that you do the theory at home and you have more hands-on hours if you visit the course. The training should not stop the learning when the course stops. You should embrace the lifelong learning principle and continue learning. Numerous research has shown that this is important in the domain of musculoskeletal ultrasound. Always follow the rules and regulations that apply in the country you work. Please always stay within the scope of practice. Only scan those things for which you have followed courses, which belongs to the domain of physiotherapy, and for which you know you can deliver the right quality. Pursue the highest quality possible, especially in those countries where musculoskeletal ultrasound and physiotherapy is new. If you are going to make a mistake, you give reasons and arguments to skeptic people with a different professional background who would like to forbid physiotherapists making use of medical imaging. Making mistakes could influence the future of musculoskeletal ultrasound in physiotherapy negatively. On the other hand, delivering quality and confirming scientific research that musculoskeletal ultrasound is not profession dependent, it influences the future positively. Therefore, we suggest that before you start earning money with musculoskeletal ultrasound, before starting your marketing and before contacting your network, you should first practice low profile in your own daily work until you reach a certain level of quality that is needed for your business model. External factors influencing the success of the business model include, for example, the quality of the equipment. The equipment you're using also affects the diagnostic accuracy. Make sure you buy quality that serves your long-term musculoskeletal ultrasound goal. If you only wish to use ultrasound for biofeedback purposes, you can buy a different quality than if you're going to use the system for diagnostic or interventional purposes. We always suggest to do first a course in musculoskeletal ultrasound before buying an ultrasound system. In that case, you learn much better what ultrasound is about, what kinds of quality there are, if you like it or not, and you know exactly what suits you and your practice best. If you buy a system, make sure that it has at least the most commonly used functions. Ultrasound manufacturers constantly work on the software to improve the quality. A software update might be wise after a few years. More money buys more diagnostic accuracy, provided that the operator-dependent influencing factors are optimal. Some other external factors which are less easy for you to influence are having consent of the referring professionals. Visit them, invite them, explain what you do, show them how qualitative you do it, and ask how you could be of any help to them, how you could strengthen them. Tackle this polite and politically, and you will see that most professionals will support you. It might not be immediately, but if you deliver time after time quality and you regularly reach out to them, things will turn out positively. We suggest that you won't be afraid for the very few professionals who maybe don't endorse your new way of working. Physiotherapy Association endorsement of using musculoskeletal ultrasound in physiotherapy would be a big help in the political lobby. If there are more physiotherapy associations in one country, it would be optimal if they would unite and have one common opinion. The profession of physiotherapy, we the professionals, and the Bachelor of Science and the Master of Science educational programs are responsible for researching the added value of musculoskeletal ultrasound in physiotherapy. These data can be used to motivate healthcare insurance companies to reimburse musculoskeletal ultrasound assessments performed by physiotherapists in the future. Thank you for watching.